Assalamu alaikum, the communication day. First scenario, you are the doctor in the emergency unit. Patient wife, Anna. The scenario, Mr. John is a known case of COPD, chronic obstructive pulmonary disease, and presented to the emergency with acute shortness of breath. The emergency team suspected pulmonary embolism and sent D-dimer, which came out to be high, so they gave him the therapeutic dose of enoxaparin and requested CT pulmonary angiogram. The radiology team rejected the request for CTPA due to a low Wells score for this patient. Meanwhile, the patient got treated with inhalers, IV steroids, which improved his shortness of breath, and he was discharged on optimal inhaler therapy. Your task is to talk to the patient's wife and inform her why CTPA, CT pulmonary angio was not done, and address her concerns. Ready, Dr. Fahad?
Yes, doctor.
Okay.
Hello.
Yes, Dr. Minam.
Hello.
Yes, here you go.
I am Dr. Farhad, one of the doctors in emergency clinic. Are you Mrs. Anna, wife of Mr. John?
Yes, doctor.
Okay, Mrs. Anna, we are here to discuss about your husband's health condition. Is that okay?
Yes, doctor.
Okay, before we start, may I know how much you know about your husband's health condition?
So, doctor, you know that my husband has some difficulty in breathing, and he is also has long-term illness of smoker's lung disease. And we came in the hospital, doctors did some tests, and they gave him some blood thinning medication as they were suspecting that he has some clot in the lungs. But after giving some medications, my husband uh, they told us that they are not planning to go for the scans they were telling us that called a CT scan of the chest. So I am not sure that why the scan has been refused and why you are not going for that.
Okay, right. Mrs. Anna, I am going to explain you, and if you have any query, you can ask me. Just at first, let me explain about what is this pulmonary embolism you mentioned. Have you understand that? Can I explain it more?
No, doctor, they told me about that. It's an emergency condition when there is a clot in one of the blood channels in lungs. So that is why they give
Okay.
him the blood thinning medication.
Okay. So, our emergency doctor, they think that it is a life-threatening condition. So they started for the best interest of your husband's life, and they give the injection and advise is high resolution imaging of chest called CTPA
Mm.
to diagnose the condition. Do you understand that?
Yes, doctor.
Okay. So what happens next? Our radiology team, they seen the your husband's condition, and they form a score known as Wells score. This is a score to see any blood clot in our blood channels, and they found that this score is not too much high for your husband's. This means that your husband has less probability to have clot in blood channels. Do you understand, Mrs. Anna?
Doctor, I understand, but that I was thinking, doctor, that if that score was not very low for my husband as unfit for the test, then why you give that blood thinner to why in a very high dose? Why it was given then?
Yes, I understand your concern,
Mm.
but this is given for the best interest of your husband's condition, because if it was actually a pulmonary embolism, that means a clot in the blood channels in the in lung, then it is life-threatening, and your husband may die at the very moment. So to prevent that, they give the blood thinning medication. Do you understand that?
Okay, doctor.
Okay, but later on, when our radiology team found that their score is low, so they didn't do the high resolution imaging. And also, this high resolution imaging is injurious for our health. Like this high resolution imaging CT scan, it causes some health problem also. Uh, but we are sorry that we give the blood thinning medication to your husband. But we manage your husband's condition by giving some other medication. Do you understand, Mrs. Sana?
Doctor, I understand that you did that to save him. But doctor,
Yes.
the test you did that I was informed the D dimers was so high. If it's so high, then why don't you go for the chest scan? What is the problem?
Yes. The D-dimer,
Mm-hmm.
it is a special test in the blood.
Mm-hmm.
If it is high, then we suspect some clot in the blood channels. But it may
Mm-hmm.
rise on in many other conditions, not only that. So it may be falsely raised. So we'll form a group of specialists, and we'll discuss this matter, and we'll inform you about that. Is that okay?
Okay, so doctor, you are saying that you will plan to this scan later, means after discussion with the team. You are telling me this.
Uh, After discussion, actually, why it was not why DDMR was high and the platinum medication was given, we will
Mm-hmm.
inform it to you. Okay. But your husband is now okay after giving the medication for your you said the smoker's lung. After that, your husband is now okay, isn't it?
Okay. So doctor, what should I
Oh,
do? I'm scared that you guys have given such a large amount of blood thinner to my husband, and I'm so scared how to take care of him now.
okay. As because this blood thinner is already given, but it will undergo breakdown in the body. But we'll advise something like he should not from any cut injury he may bleeding more, and if he notice any blood from any like nose, mouth, or from teeth, they must return to clinic quickly. Is that okay, Susanna?
Okay, doctor.
And do you have any other concern?
No, doctor.
Okay, and now your husband is living with you or any other family
Uh,
members with you?
Me and my husband, doctor.
Okay, so if you need any help, we can help you. Okay.
So, doctor, do you think that this can happen again?
Uh, what kind of thing? Can you please
A
tell me again?
pulmonary embolism that you were suspecting in the first place. Does it can happen again? Something like that.
Uh, yeah, pulmonary embolism as he is suffering from a long-term condition of lung. So there is a possibility it can happen. Okay.
Okay.
And does your husband drive?
Yes, doctor.
Okay. So and does he smoke?
No.
Okay.
2 minutes left.
And as because he is suffering from long-term lung condition, so I think if he has quit the smoking, it's better for him. And does he drink alcohol?
No, doctor, he doesn't smoke. I told you he doesn't smoke.
No alcohol.
And no alcohol.
Okay. And if you need any kind of help, we are here to help you and support you. And we can give you a brochure leaflet about his long-term lung condition, COPD, and also the clot in the blood channels It's called pulmonary embolism. So you can know the sign, the symptoms he may develop, and you can return to clinic quickly. Is that okay?
Okay, doctor.
You have any other query?
No, doctor.
Okay.
Are you done, Dr. Fahad? Do you want to ask, to add, to instruct? Any other
Okay.
concern, Dr. Minam, you want to add?
No, sir. No.
Okay, so let's go to the comment. Dr. Minam, you can start, please.
Okay, sir, I start my scenario.
No, your comment. How was his performance? And how he did the
Uh,
scenario, how he drive it? Is it in correct way? What was he miss any of the concerns, the concept?
as
Yes.
Yeah, sir, I was thinking that, sir, the side effects or bad outcomes of the CTPA uh, can be defined more like any radiation side effects or any allergies or any kidney damage. Anything more can be told to the patient that why we are not interested, other than the radiology department. And so there was a point also uh, discussed that it was said that Bell score was low, but as she was continuously asking that why the city was not done, why you are not doing, and we are willing to go for it. So it was discussed in that way that as Miss Anna, your husband's condition has improved as well. It is also one of the reasons that it was could be the flares of underlying condition. The chances of clot was less there as well, and then the bad outcomes of CTPA are in that way we can discuss about some radiation and some other side effects so that we can see that she can see that why we are not going for that CTPA. Other than that, I feel that maybe some empathy or sympathy can be more as well. That's it.
Okay. I agree about these concerns and this comment, but I will add more comments. I will ask first, Dr. Fahad, what did you understand from this scenario? Is there pulmonary embolism?
Uh, no, from the scenario, it is understand that maybe he is suffering from breathlessness, and for
Yeah,
that,
so they consider it as a COPD exacerbation, right? And they give him some inhalers
yeah,
and some bronchodilators and some medication, antibiotics and steroids. Okay, so no pulmonary embolism at all, no suspicious, and even they canceled the CTPA. What? Why you advise regarding anticoagulant?
actually, when the patient first come to emergency department, at
No,
that
no,
time he was
not initially. She asked you, will you keep him on anticoagulant? I think blood thinner, and you said yes, right? Or I'm wrong.
actually from the scenario, I understand that as because he was breathlessness, so the emergency team suspected he may
Okay,
have pulmonary embolism.
yeah,
That's
they
why they
started.
give him.
They give initially.
Yeah, yes, yes.
Yeah, and she asked you one of the concern. Will you keep him on blood thinner? What was your
No, no.
answer?
Uh, Actually, it should not be. Blood thinner should not be.
Okay, what I understood, you said yes, he would be on anticoagulant. Okay, let's say, go concern by concern and let me know if you are answering the same. Okay, I wrote the concerns here in the chat box. The first concern was yes, why you give the blood thinner? I think it was wise to say yes in the best interest of his condition. Once we suspect the blood clot, the pulmonary embolism itself, as a blood clot in the blood channel, one of the life-threatening condition, it might threat his life. Our team prescribe for him the blood thinner medication. Okay, I will answer shortly, then I will go with the discussion with all of you, along with the comments in the chats. The next question: why you will not proceed with the scan? I think, what was your answer regarding the scan?
Because the Wales for the radiology team,
Okay, good.
they
So you give me the same answer of the discussion or during the discussion. What do you think the patient or the husband or sorry the wife will know about Wells score?
yes,
So
I need to explain.
is it wise to tell her Wells score for the for your husband was low?
No, no,
Okay,
it
so
is
yeah, it's like a major jargon. Wells score and the criteria of Wells score. You are explaining medical criteria to non-medical team or non-medical person. How to correct this? What do you think? How to say to her, we have this and we didn't do that? Can you do it again? Try.
yes. Our radiology team, they
Okay.
have
So don't start with the radiology. If you want to say, you can say image doctor or scan doctor.
okay. So
Okay, continue. Yeah.
our imaging doctor,
Okay.
they
Okay.
have performed a examination of your husband, and they found that your husband has low probability of having blood clot in the blood channel.
Okay, I will correct it more. Do you think the radiology himself is the one doing Wells score or Wells criteria?
No, actually,
Yes.
physician also.
This is the role of physician and the primary team, the pulmonology. Okay. Yeah, but it's wrongly written in the scenario. You're right. They wrote it. The radiology team rejected the request of CTP due to low Wells score for this patient. But if even they wrote that, you have to realize that the doctor who will do the wills are not the radiologist. That's why even the radiology decided for that, it will be based on the physician or the general practitioner or the IM or the pulmonology, not based on the radiology, because then never ever the radiology assess the patient by himself, right? Unless he will do the scan. So let's go back. If you want to answer it, how to do it, how to say.
So our lung doctor, imaging doctor, and
So our team,
uh, our
it's our
team,
team. Yes, okay, our team. What they did,
they examined your husband thoroughly, and
okay,
they found that your husband has less probability of having a blood clot.
okay, using what?
Using a here I have to mention Wells score.
Yes, you can say using criteria that we are applying for every patient with blood clot or pulmonary embolism. No need to
Okay.
mention the name, okay, but at least based on something, based on guidelines, they are not doing this by themselves. There is something they are following. There is certain criteria they are applying on your husband to know if he is still under a term of high possibility or low possibility. And in your husband condition, it was low possibility. Clear? So our team, after assessing and examining your husband, we found that he has very low possibility to have a pulmonary embolism using a score or using a criteria which is applied in every patient with pulmonary embolism. Okay, this is the way how to address without jargon and based on guidelines or based on score. No need to mention the score, and even if you mention it, explain it. If by mistake, for example, Dr. Fahad, if by mistake you said there is Wells criteria we're applying for every patient, don't bother about this criteria. It's a name of our criteria. We are using it to assess our patient. Okay, if you mention it by mistake. So don't say will score and she will guess, oh, doctor, oh, it looks something complicated. What's Wells, doctor? Okay. So in order to avoid it, even if you mistakenly mention it, explain it in non-medical way. It's one of the scores or criteria. We are doing assessment on every patient to know if this patient is highly possibility to have the pulmonary embolism or no. And in your husband, it was low. That's why the image doctor, along with our team, they decided that no need to proceed further with the CT or the image with the dye. We will go further for the contrast because you mentioned high resolution CT chest and the image. What was Dr. Fahad? What was the image mentioned in this scenario?
Imaging,
Yeah, what the
uh,
imaging
C-
image?
CTPA,
Okay, CT pulmonary angiogram. Is it high resolution CT chest?
it is actually high resolution to see the blood channels in the lungs.
Oh, okay, so don't use high resolution because yes, you can say high resolution is or advanced CT or advanced scan, but high resolution usually we are terming this on the one without
HRCT.
contrast.
Okay.
Yes, so don't even give impression to the examiner that you are mixing the things. Mentioning high
Okay.
resolution without contrast or with contrast means that you are mixing the things. This is a term and this is another term. So if you want to mention, we are doing a scan using a contrast, which is a dye, injecting through the blood channel to draw the vessel or the blood channel of the lungs to be sure it's not a clot or it's not pulmonary embolism. Okay. The next concern, why you don't go with the other scans? Dr. Fahad, how to address?
Because other scan cannot detect the this blood clot. Only this scan can detect blood clot in the blood channels. That's why.
And what do you think the harm of other scans if you want to decide for other scan? Okay,
I don't know.
let's talk about this. Yes, it's not necessary, and the other scans will not help us to diagnose the condition. The best interest scan for your husband condition was the one mentioned and decided earlier. However, it was cancelled again in the best interest of your condition. What do you think the two reason or the most serious condition or the most serious concerns about cancelling this CT? What if you will do the CT and that's it? What the problem? We'll do the CT and let's see the result, even if he has low possibility. What do you think the harm will happen?
Yes, there are many harm like this contrast may cause kidney
Perfect.
problem.
Yes, so the harm of the dye itself, okay? The contrast, we can call it as dye.
Die. Okay. Yes.
Yeah, so the dye can harm the kidney. What else?
And also it may cause some allergic reaction.
Exactly, yes. This is another harm. What the third and major also?
And there is radiation problem.
Perfect. So we mentioned all the hazards of the CT unnecessarily, if done unnecessarily, right? But in this scenario, it was cancelled because it's not necessarily now to be done based on the Wales criteria. Clear? Clear. Let's go to the next concern. Yes, after discussion with your team, will you proceed with the scan, Dr. Fahad?
Sorry.
Yeah, after discussion with your team, will you proceed with the scan?
No, no.
How to answer it in good way? Don't say no, no only.
Uh,
Because she's still
so
waiting to do it, right? She
yes.
want to do. So
So
how to do? Because she's trying to insist, please, can you discuss again with your team? And if you discuss it again, will you do the scan, doctor? What do you think the answer?
our team has decided that this scan is not good for your husband overall condition. So it's better not to do this scan.
Okay, first appreciate her worry. I know it's so difficult to feel that it's sounds so difficult for you. I know it's difficult to understand all the things. And I appreciate worry, whatever you want to say, just do some preparation before giving the answer. Yes, again, in the best interest of your condition, we will not do and we will not proceed with this scan based on the team decision. Okay, back to the last concern. Okay, will the PE happens again? Will the PE happen again, or would it happen again?
Yes, I can say that there is a probability that uh, these blood clot in the lung blood channels can happen.
Okay, if you want to answer in professional way, how to do so?
Uh, I can say that there is a probability. I cannot assure that
Again,
it is.
don't talk about the concern only. You have to appreciate and to prepare. Okay. So what you can
Oh,
say, I can see how much you are worried about your husband, right?
yes,
And I can say I'm afraid to say, or sadly, in his condition, since or while he's having such condition in his lung, still he has a possibility to have a pulmonary embolism or the clot in the future. However, don't worry, we will follow up your husband. We will take care of this and we'll give him some instruction, advice to avoid happening again. Okay, clear? Okay, let's go to the other comment. Do you understand the last time I told you try to avoid this word? Do you understand means she is not understanding? There is something wrong with her. And maybe you are the one wrong, not her. Okay, so the best way, are you following me?
yes,
Am I clear so far? These are the questions you can you can ask her, and she will tell you if she is not understanding. She will tell you, Doctor, I cannot understand. So don't wait for or don't give her the option or the question of do you understand? Clear, Doctor Fahad?
yes,
Okay, the introduction itself. I am Dr. Fahad, one of the doctors here. You are the wife of Mr. X, right? Are you the next of kin? You have to know. You are talking now to the next of kin or no, because you are talking about another person, so you should talk only to the next of kin. This is one of the confidentiality point, and you can assume that we assume that, or I have approved from him to talk with you about his condition, or I had a permission from him to talk about, or assume that we have permission from him to talk about his condition. All these to show the examiner that you are not breaching the confidentiality of the patient. Clear? So whenever you are talking to second person, you have to be sure that he is the next of kin plus the permission, assume the permission from the husband or the patient to talk about his condition. Is it clear?
yes.
Okay, what do you know about your husband condition? And what's the expectation? To know what's ongoing in her mind. And according to her expectation, you can start the discussion. If she expects that you will do the CT, you can address the concern immediately. Oh my God, I can see how much you are worried about your husband. Let me explain to you about what happened exactly, and so on. You didn't talk about PE. Even if she knows about the PE, you can ask her, would you want me to explain more about pulmonary embolism and why it was serious and why it's a serious condition? So you can give her some impression that what has been done in the admission or during the admission was in the best interest. We suspected something to be serious can threaten his life. It's called pulmonary embolism. Have you ever heard about it? No, doctor. You want me to explain? Yes, please, doctor. Now you can say according what you understand about the PE. You can do it in the non-jargon way. So it's one of the blood clot in the blood channel in the lung, which can threaten his life. That's why Mr. X presented with short of breath. In the best interest of his condition, our doctors and our team in the emergency has been given him a medication called blood thinner enoxaparin, what according what's written in the scenario. And this blood thinner, in the best interest of his condition, supposed to be given once we are suspecting this condition. Are you following me? Do you am I clear so far? Okay. Then you can go with their concern one by one. Did you get
But
it? Yes.
yes, but, I asked her about the pulmonary embolism. Then she replied that it is already explained.
Yeah. I know. But I mean, in the other scenarios, you have to ask. I think you asked this in this scenario, but you didn't tell about the seriousness, how it's
Yes,
serious, right? And why we give it the blood thinner. Okay, and in the best interest we give. Also, in the best interest, they did the D dimer and it was positive. They advised to do CT. You're right, we didn't proceed with it. Doctor, why you didn't do it? Can you have a reason for that? Yes, I will come to that, Mrs. Anna or was Mr. X. I will tell you why we didn't do it. Then you explain the importance of not to do the scan based on a clinical judgment. Okay? Always use the risk and benefit in the best interest, and the risk and the benefit outweighing or weighing both of them. Which one is outweigh the other? If the risk outweigh the benefit, we cancel this scan in this way. Okay, it's okay, Dr. Fahd. I know it's a lot of comments, but with the time you can avoid these things. Clear?
it's okay.
Yeah, I'm so sorry if you feel like disappointed. I know it's little disappointed, but yes, learn from these things. Otherwise, you will not be on the good track. Okay, Doctor Minan, this is your turn now. You,
Sir, I have a question.
yes,
Sir, is it a complete scenario? Can you please read?
yeah. I will read it now. Please give me a
Mm-hmm.
second.
Mm-hmm.
Doc, yes, you are the medical registrar in the stroke unit, Mr. Kamal Hussein, 67 years old man, admitted yesterday after a suddenly noticing difficulty seeing on one side while reading and walking. He also developed weakness on the right side of his body. Okay, it's counsel and that's it. Yeah, he mean counsel about what happened with him.
Okay.
Okay, so you are talking or to counsel about the stroke.
Yeah, sir, I got this. Like, I have to counsel on stroke.
Okay.
Mm-hmm. Should I start, sir?
No, you are ready. Okay, let me just
Yes.
finish the comment, the message before
Mm-hmm.
starting because once you start, this message will not discuss it again. Okay, let's start from Dr. Sarah Ibrahim. The harm from CTPA is more than the benefit. Perfect. In your husband condition, as he has not high risk of PE, and the contrast will be given in the CTPA can cause problem as renal failure, allergy, anaphylaxis. You are talking in medical way, Dr. Sarah. But once you are explaining, don't say any of them. Plus, it's not renal failure. It can affect or harm the kidney. That's it. Okay, don't say renal failure. Some patient can pass without the renal failure. Just harm the kidney. You don't know the percentage of the harm. How much will it happen or no? Just say it will harm the kidney because it's a dye, and this dye can affect the harm or the kidney or harm the kidney. But you're right as an information. But how to deliver? You have to do it in non-jargon way. Doctor إهداء uncertainty scenario. Explain PE. Treatment improve the condition. Cancellation of CTs and risk due to well score. Perfect. This is what we have done. Why CT, Dr. Gabriel? Why CTPA was not done? Though This was initially requested for the following sudden shot of death and high D-dimer. However, the radiologist released that the Wells score, which tells the probability of someone should develop PE, this score was low, and so the CTPA request was rejected. Yeah, that's it. You can say cancelled, don't say rejected. Okay. Dr. Zoom, because clot in the lung is one of the life-threatening conditions. Exactly. If we delayed the waiting scan, hopefully our team after assessment said the diagnosis is far away. Okay, you can say it's not the diagnosis, but don't say far away because it might be there. Still, the dimer is positive. Okay, they didn't do based on Wells criteria, but you don't know what will happen. They might cancel or they might change the mind again, and they can do it later on. But right now, meanwhile, you read the scenario. Meanwhile, see, meanwhile, the patient treated with 1, 2, 3 and improved. Okay, you don't know what might happen in the future, so don't say it's far away. And there is also possibility to have it in the future. Okay, don't make it as excluded totally. As we know, D dimer is one of the good negative, but it's if positive, the PE is still one of the possibility to be there, right? The Dr. Ivanthi, you can explain that CTPA also has some side effects to when we selected patients with extra caution. Yeah, it's the same idea, Dr. Ibrahim Ashur. Also, CTPA carry risk of unnecessary radiation. Perfect. Contrasts exactly side effect. Dr. Ibrahim, the clot in the lung is life-threatening. So if we suspect to need urgently start blood thinner until ruled out by appropriate scan. So this is safe and temporary measure. Perfect. We work as a team, radiology. So don't say radiology, you can say scan doctor or imaging doctor, medical stuff. If his condition will not keep improving, we will do blood test again and the chest scan exactly. Dr. Eda, yes, cancelled. The question for to be replaced, rejected word 1. Yes, you have to say cancelled, not rejected. Okay, now we can start. Dr. Mina, ready?
Yes, sir.
Yes, here you go.
Hello.
Hello.
I'm Dr. Akbar. I'm one of the medical registrar in the stroke unit today. May I confirm that you are Mr. Kamal Hussain, 67 years old?
Yes, Dr. Right.
Mr. Kamal, how may I address you?
Hey, you can call me Kamal.
Mr. Kamal, I'm here to discuss regarding your health condition. And before starting the discussion, I would like to know that do you want anyone else to be in this meeting today with you?
No, doctor.
Okay, so to be on the same page, I would like to know that how far do you know about your condition and what are your expectations from today's meeting?
Yes, doctor. I know that my body suddenly developed weakness in one side, and I cannot see clearly in my one eye. And this happened suddenly. So actually, what happened to my body? Can you please tell me?
Mr. Kamal, I appreciate your concern regarding your condition. And yes, you had some weakness and you had some difficulty in seeing the things as well. So, after assessing your condition, the treating team come up with a condition we call it as a stroke. Have you ever heard about this?
No, doctor. What is that?
Okay, so I would like to explain you more about it, and I would like to draw it for you for your better understanding that this is our brain, and there are blood channels in the brain. So a stroke is a condition when there is a clot in one of the blood channels in the brain, so that the blood supply to a part of our brain becomes stopped, and that is why you can have the similar symptoms of weakness can be in any part of the body. You can have some problem in your vision. You can have some difficulty in your speech as well, and there could be other problems as well. Are you with me?
Yes, doctor.
So, there could be a number of reasons a person can have this condition. Maybe some underlying condition can be one of the reasons as well. And it could be reasons with some heart problems. And sometimes it can happen in any way to a person as well. Are you following me?
Yes, I'm following you, doctor.
Okay, so
So,
Mr.
is it
Yes,
reversible?
please. You are right, Mr. Kamal, that your concern is fine, but stroke, it's a kind of a condition that it requires a lot of patience and a lot of physical and strength training. When there is some kind of a damage in any part of the brain, you have a form of a permanent weakness, right? And I have a plan of management and care for you, that how we will help you during this journey. Do you want me to explain you more about it?
Yes, doctor. Please explain. You said that I have a blood clot in my blood channels in my brain. So give me some blood thinner.
Okay. So before answering you, may I know that is there any long-term illnesses you would like to tell me?
Yes, I am suffering from high blood sugar and also high blood pressure.
Okay. Okay, all right. And have you been taking medications for that as well?
Yes,
Okay. So now coming back to your concern, Mr. Kamal, we will be making a team of doctors. There will be a brain specialist and some specialized stroke nurses will be here as well. Some physical strength training therapists will be here, and we will be starting you on some medications. It could be, according to the team, could be some blood thinners will be given to you as well, and we will be keeping you on physical strength training programs as well. We will be monitoring your blood pressures, and your we will be keep monitoring your sugars as well. We will be including. Are you with me?
yes,
Okay. So we will also be um, looking for your diet changes as well. Some we will be looking to that as well, and this will going to be the plan, and we'll keep you in the follow-ups as well in the stroke clinic. Are you understanding me?
yes, doctor. Doctor, I have a
Okay.
query that
Yes, please.
I have some weakness. So will I walk normally again?
uh, Mr. Kamal, your concern is quite fine, but may I know that what do you do for a living?
Yes, I am a school teacher, but now retired.
Okay. So Mr. Kamal, stroke is a kind of a condition when there will be permanent weakness in any part of the body. But with continuous physical training, some physiotherapies, with proper medications and exercises, your weakness will improve. But it will require a lot of patience and a lot of time. Are you understanding me?
Yes, doctor.
Yeah, but it requires some time. Like it's a manageable condition, but it depends on person to person that how will you respond to the physical training, how you follow the diet, how long it will take. Every person responds differently with the treatment. So it will be depending that how controlled your blood sugars will be, how controlled your blood pressures will be. We will be keep following you. We will be keeping you with the physical training. Some physiotherapist will be there as well. So with time, things we hopeful that things will improve.
Okay.
Are you
Doctor,
following
and
me?
what about, yes, doctor, and what about my vision? I cannot see actually in one side.
So right now, as I mentioned you that we will be starting you on the blood thinning medications, and we need to see that if you require any form of other treatment for your vision as well. But we will be starting you on the blood thinning medications, and other than that, for further test, if we need to do, it will be seen that if you require for that. But we'll keep you in the hospital right now, and we'll see that how long you will require the treatment till we further assess your condition.
Okay, doctor. And I have another query, doctor. That
Yes.
can this condition happen to my another side of the body? Then I will be totally paralyzed.
So, Mr. Kamal, that this can happen. This can happen, and but we need to see that what was the cause, and after this stroke we will be keep you on medications. We will be controlling all the risks, like your underlying blood pressure should be strictly monitored, the medications, the blood controlling medications, and your underlying diabetes should be strictly controlled as well, so that we can avoid the chances of further strokes. But the chances are always there. Are you following me?
Yes. Mm.
So, may I know a few things from you, if you don't mind?
Yes, yes.
So, may I know that who do you live with?
Yes, I live with my family, my wife, my
Uh,
children. Yes.
1 minute left.
okay, and is there enough support available at your home?
Yes, they're all supportive.
Okay, and at which floor do you live?
Uh, Ground floor.
Okay, and may I know that do you drive?
Yes, I drive
Which car, which type of a vehicle do you drive?
car.
Okay, so you will be stopping your driving for a month at least, and you will be informing to the driving and vehicle authorities till they further assess your condition. Is it fine with you?
Okay, doctor.
And may I know that do you smoke?
Yes, doctor. Before I smoke, now I quit.
Okay, and what about alcohol?
No.
Okay, all right. So, Mr. Kamal, I would like to tell you that we will be sharing the some leaflets and brochure about the conditioner as well, and we'll update you about the further management about the condition as well. In case of any other problems and any queries, you can contact us as well, and we will be updating you for further management plan as well, and we'll keep you in the regular follow-ups as well.
Okay,
Are there
well
any
done.
concerns for me?
Yes, time is
Thank
up.
you, doctor.
Time is
Okay,
up,
thank
Dr.
you.
Minam. Well done. Dr. Mafad will comment, then I will comment. Please, Dr. Fahad.
Yes, Dr. Mina, she performed very well. Actually, it is counseling about the stroke, and actually he answered all my concern. One thing is that he started blood thinning medication. I think we can make a group of specialists, and then we can decide his treatment.
Mm.
Other than that, I think she's right. All right.
Okay, thank you, Dr. Fahad. Good scenario. And well done, Dr. Minam. I will comment now on your performance.
Hello.
But yes, yes, we can hear you. Yes, we heard you, Dr. Fahad. Yes. Do you hear us, Dr. Fahad?
Hello.
Dr. Fahad, we can hear you.
Yes, I commented.
Okay. Thank you, Dr. Fahad. Yes, I hear your comment. Okay, I will comment now. First comment, anything the patient is doing well or fine, please appreciate it, Dr. Minam. He stopped smoking. He told you, I quit already smoking. Appreciate that. Okay, so I either say good to know, I appreciate you stop smoking. Glad to hear that. Anything just to give impression that you are appreciating this thing. Okay. This is the first lesson. Don't skip it like he didn't do. Why? Because the appreciation always gives the motivation not to have it again. Plus, he can understand this is harmful. Okay, we will start from the end. Okay, let's talk about the introduction was perfect. Introduce yourself, confirm the data of the patient, and invite someone to attend. It's a good idea. This patient is having acute stroke, sorry, and he might be depressed, and he might need someone to support him in this bad news. Okay. The good thing here also you draw while explaining the stroke. Is the stroke one of the breaking bad news? I believe yes, because it can cause disability. In his condition, he has left side weakness, right? Or what side he has? Let's confirm, please.
Right-sided.
Yeah, right sided. And if he's right-handed patient, he could be also aphasic, and you couldn't talk to him again. Anyway, consider it for me. I will consider it as breaking bad news. I will do the golden silence warning shot, and I will start to explain the stroke as Dr. Minam did. She drew the brain and the blood supply was blocked by a clot, and certain causes can be behind that. One of them, I prefer not to ask about past medical condition because it will consider as taking history. One of them could be a long-standing disease. For example, diabetes, high blood pressure, or high blood sugar. And he will tell you, yes, doctor, I have high blood pressure, or I have high blood sugar. Yes, I appreciate sharing this with me. Or he will share it earlier. When you ask him, what do you know about your condition? He will tell you, doctor, I am diabetic for since long time. You can use it again as a weapon. It's the condition or the stroke happened because of the blood sugar or high blood sugar. And the blood sugar usually disturb the fat in the blood. And because of that, you have that, the stroke, I mean. Okay. Rather than asking him, are you having any long-standing disease? Okay. So you are taking history and what you are taking for it. Another question, consider as taking history. Okay. Other than this, yes, certain people, even without, he might have the stroke. So you give him the pathology, why he had the stroke. Either because of long-standing disease, you can say because of smoking, and he will also be honest. He will tell you, yes, I'm a smoker, or I have been a smoker for a long time, but now I stopped. Or sometimes it can be running in families, okay, like familial condition, like familial hypertriglyceridemia, right? So it depends on those factors. You might have one of them, or you don't have. We will confirm later on why you have this stroke. For meanwhile, what we want to do, along with a group of doctors, including the brain doctor, as you said, the limb physiotherapy, the heart doctor if he has hypertension, or the blood sugar doctor, and the physiotherapists you mentioned, the occupational therapist is very important. Did you invite them?
No, sir.
Yeah, so occupational therapist, one of the teams, they can provide you with the aids to help you to cope with your daily activity. Okay? And specialized nurse to help you how to do so in the coming days. We will arrange a lot of follow-ups in the clinic of the brain doctor along with the physiotherapy. Finish. Now the turn or the time for the concern. Let's read his concern. I wrote it down here. Okay, wait. Yeah, will you give me the blood thinner? Actually, yes, it can be by you if your role is one of the doctors in the neurology clinic. But what's your role here? It was? Let me
A
read it.
registrar. Registrar.
Medical registrar. Okay, stroke unit. So I agree,
Yeah.
doctor. Yeah, so stroke unit, you are the
Mm.
doctor there, means
Mm.
that you have the authority to start him in blood thinner.
Mm.
However, it's okay to say it. Yes, you can start, or we will start you in the best interest, along with
Mm.
the group of doctors, the blood thinner medication. Why, Dr. Fahad, I said that? Because it's a must. Never ever stroke patient will not start on blood thinner. I don't think, based on your position as well. No need to call the doctor who will prescribe this medicine. But it's okay if you want to be safe. If you want to be safe, yes, we will have a decision with the other
Mm.
doctors to start you on the blood thinner medication. But mostly he will start on, right? As we know, in the stroke, most of the patient will be lifelong on aspirin,
Mm.
right? Unless he has another like AF, like comorbidity like AF or thrombosis or thromboembolic risk, he might even switch to anticoagulant after 21 days or 2 weeks. Sorry, after 2 weeks, he
Two.
might switch.
2 weeks.
Yes, exactly. So it depends on the scenario. Either you are the doctor in the stroke or just a doctor to counsel. But to be safe, you can mention the team who will prescribe the medication. This is the first concern. The second concern, doctor, will I walk again? Again, please appreciate his worry. Yes, I can see how much you are worried about that. Thank you for asking this. Hopefully, with the long term physiotherapy, we will provide you
Mm.
along with the follow up. As you said, yes, some
Mm.
patients they have the ability again, or they can regain the ability to walk again, along with our support. Okay, because yes, there is some of them they will have the dense weakness that it will not respond even to the physiotherapy. So some of them they can walk using walking aid or stick, but some also can be difficult to walk. Okay, so it depends on the stroke and the size of stroke. But we will do, always reassure, we will do our best to be sure that you will be able to walk. Okay, by our aids, I mean. So we will provide you some aids to help you to walk. Okay, the next
Yes, sir.
concern, what about my vision? I think you didn't address it. What you answer it? He asked you, what about my vision, doctor? What did you say?
Sir, I told him that we will be starting you on the blood thinners, and we'll see that if you require any other things for your vision, the treating team will assess the condition and will decide accordingly. I responded that way.
Okay. And what you miss here? What team you should involve?
Sir, the stroke team will be here.
The vision, regarding the vision.
Yeah, the I team.
Yeah. So the I team also will be there. They will assist you and they will help you to and to they can update you regarding your vision.
Mm.
Okay.
Yes, sir.
The next or the last concern, will I be paralyzed if I have another stroke? And yeah, to the other side, give me good answer to this question or this concern. See how worried he is and address it.
So, Mr. Kamal, I can see that how worried you are about
Yes,
your condition, and
exactly.
we are here to support you and see the things. So, there are chances that you can have uh, another stroke, but we'll be sure that we will be monitoring your underlying conditions. You will be on the proper follow ups. Your blood pressure should be controlled, your sugar should be controlled. We will be monitoring that how what kind of a diet you are taking. With all these lifestyle changes, there is a possibility that you won't have another stroke if you live a healthy lifestyle. But
Perfect.
still, okay,
Yes, so you are always saying yes, there is good
some
hope.
chances.
Yes, there is good
Yeah.
hope for that. If you live good and
Mm,
healthy lifestyle, possibly you will not have another stroke if you follow up with us, if you take healthy diet, if you take your medication in compliant way, if you control
mm,
your diabetes, hopefully we can prevent or we can avoid another stroke. However, there is some possibility if you change or if you have unhealthy or lifestyle modification which is not followed as we mentioned.
mm. mm,
This is the good way, and always appreciate his worry. This one is thinking about another stroke that can put him in the bed. So you have to
mm,
appreciate that. And also reassure him with the follow up. We will not
mm,
leave you alone. We will be beside you. We will support you, and so on. Okay.
mm. Yes, sir.
The social here is very important with whom you're living. Do you need
Mm,
any kind of support at home? Yes, as you did. Do you smoke? And he, as I, again, if he said, I quit, it's good to know. Thank you for stopping smoking because it's one of the risk factor. Do you drink alcohol? No, doctor. Do you drive? Which is good also to address here. This patient
mm,
is losing his sight in one side.
mm,
So I am stop or I'm advising you or highly or recommending you not to have drive and to inform your driving license. Okay,
mm.
that's it. I think you did it in good way, apart from the smoking part, but you have to appreciate it.
Yes, sir.
Okay, thank you, Dr. Minam. Now we'll open the discussion. Anyone want to comment?
Thank you, sir.
Yeah, thank you, Dr. Basim, and the participants.
Mm.
Sorry, Dr. Basim, before you go into the comment, I have two queries, if you don't mind.
Sure.
The first one is the second scenario. Okay, I see that it was, I don't know if it is, uh, it is good to assume that it's ischemic stroke, but because what was explained to the patient more or less was like ischemic stroke, which I consider it was not mentioned in the scenario. So I was just wondering, is it okay to just to assume that it's ischemic stroke when we know, I know ischemic stroke is commoner than hemorrhagic, but
Yes,
it can also be hemorrhagic. Do I'm a bit confused there. Do say we wait until we see the CT and I don't know what I just want to know.
it's really good question. Really, I like this question. So you will not assume. Okay, this is the first thing. Don't assume because it will be mentioned in the scenario. This is the first thing.
Okay.
Yes, if we assume, as you like, the major and the majority of the strokes in the this age supposed to be ischemic.
Mm,
But again,
mm,
don't judge unless you are sure. Because you are talking about, for example, ischemic and he's having hemorrhagic. It will be a very wrong pathway, right? You are giving
mm,
blood thinner and he's having bleeding. How you can judge on that? So what
mm.
I think the scenario will be more clear than this. I think also Dr. Fahad, the
Okay.
scenario was missing these things. He brought the scenario missing parts
Okay.
with the informations. And of course, the type of stroke is not mentioned, which is against the old topic. How you can judge and how to cancel about a disease which is not clear for you and for the candidate. Okay.
Okay. All
Thank you
right.
for
Thank
raising
you.
this. Yeah.
Thank you for that. Now, the second query is this word blood thinners. I used to think I don't know, even some of my patients have had to think that blood thinner does it mean antiplatelet or is it anticoagulant or both of them?
Both of them, yes. Perfect.
Both of them.
Both of them.
Okay.
And they are
Both of them.
different. They are different than
Mm.
the thrombolytic. How you are
Yeah.
calling the thrombolytic?
I'm not sure what the layman word for it actually. I'm not
Yeah, so
sure.
it's yeah, let me say it's one
Buster.
of the medication. Yeah,
Sorry.
Drug is their busters. They're called busters.
boosters.
Yeah.
Okay, we can make it more easy. You can say the medication that dissolve and break down the clot in easy and
Okay.
simple and very simple by one or term. It's a medication to dissolve and to break down the clot.
Wow.
Okay,
Okay. Okay. Okay.
always
That's
be
it.
simple as much as you can. Even the
Okay.
anticoagulant, no need to say anticoagulant. If you want to say anticoagulant, you can explain later on. It's blood thinner.
Mm.
If you want to say antiplatelet,
Mhm.
yes, it's one of the blood thinner. But both of
Okay.
them are blood thinner. Everyone has its role. So yeah, they are blood thinner, but this one work on that, and the other one work on this. if you want to mention
Okay.
later on, okay, the platelet, one of the blood component that cause a clot.
Mm.
And for the other, the anticoagulant, it's one of the medication work on the clotting, and the clotting factors are one of the blood component. Again, it can lead to clot. But it's not
Okay.
necessary to go through them unless you
Mm.
have a scenario which mention both of them, explain the antiplatelet and the anticoagulant, which is very rare.
Mm.
You are not
Okay.
prescribing both medication together unless the patient is
Mm.
just now is having MI, for example, and he will be doing stenting. After stenting, he will be kept on antiplatelet, and he has also AF with it. But I believe when once you start the anticoagulant, you can stop the antiplatelet.
Yeah.
Yeah,
Thank
agree?
you.
Yeah, most welcome. Thank you too, Dr. Gabriel. It's good information and good concern. Yes, I believe in the exam they give you the whole data of the scenario. So the type of stroke, why they have to mention? Because you are going to explain what the patient will receive, either this or that. Is it blood thinner medication, or he will have medication to help him to control the blood pressure in order not to have again hemorrhagic stroke. Okay, and of course he will be prohibited from those medication. If a patient developed ICH and he was, for example, on anticoagulant, definitely it will be stopped. And this is against our scenario today. Our scenario is going to start, for example, blood thinner, but the other scenario is to stop the blood thinner. So be sure that they will give you a clear scenario with the clear sentences. Thank you, Dr. Gabriel, for this concern. Dr. Gabriel. Okay,
Thank
the
you.
next. Thank you too. The Yeah, let's read the comment quickly. Doctor with no name. Was there any scan report as ischemic stroke? Perfect. Then why explaining only the clot? It could be hemorrhagic also. We mentioned already this. Asking for the past medical history also shouldn't be done. That's why I ask here to explain the causes as enumeration. So one of the reason is smoker. The other is familiar. The third is long-standing disease. Some patients they have possibility and higher and too much sticky blood that can cause it, like secular patient, like hemophilia patient, no, not hemophilia, sorry, the other type of thrombophilia patient. Okay, so you have to talk as an other enumeration, and if he has one of them, definitely he will tell you, yes, doctor, I am one of those or one of these. I am smoker. I have family history. Okay, so don't ask about past history unless it was written in the scenario that he has history of diabetes. So you can tell him, how is your diabetes? Is it controlled? Okay, I can see in your notes your diabetes, you are diabetic. Can you tell me how is it controlled? How is your blood sugar right now? Is it okay? Because one of the possible cause could be the diabetes or poorly controlled diabetes. Clear? So don't ask about if he has unless it was mentioned in the scenario. Dr. Mina, the scenario is incomplete. Yes, agree. Agree, it's not complete. Will you give me blood thinner? We need to do scan and then our treating team will decide accordingly. At the scenario not mentioned here. Yes, again, yes. It's depending on the scenario. Of course, if there is hemorrhagic, will not give. Okay. Dissolving clot, yes, I agree to say that. All overview, Dr. Henry. A clot burster, more formally known as a clot busting drug or thrombolytic, is a medication like tissue plasminogen activator (TPA) used to dissolve blood. See, it's dissolving here, okay? That block blood flow to the vital organs. This doc, okay, I agree to mention it, but it's not as easy as I said. Okay, be easy and simple. Imagine you are talking to your friend not to a doctor or someone in the hospital. One of your neighbors, for example, he's not in the medical field at all. You cannot say to him bursting medication. You can say medication that break down or dissolve the clots. I always advise to be simple as much as you can. Dr. Nada, for the thrombolytic medication, you will say medication to dissolve the clot. Agree? But for the anticoagulant, you will say blood thinning medication to prevent clot from getting bigger and prevent further clots formation. Absolutely right, Dr. Nada. Perfect comment. Yes. Any question? Any comment? Anyone want to add any suggestion? Any unclear point need to be clarified? Is it clear
Yeah,
both scenarios?
Dr. Bazim,
Yes,
you
yes,
know,
yes.
even the issue of blood thinners, what does it really mean? I kind of, what does to thin the blood, to a layman, how
Yes,
would they look at it?
it thin the blood and making the blood more thin, not to be sticky again and to be a clot again. We are trying to prevent the clotting, right? So the thinning of the blood will not be thick or or sticky, and it will not be collected again or sticky again and forming a clot. That's why it's called thinning. So the blood will be as thin as possible in order not to have sticky to each other forming the clot, or it can make the blood clot bigger. It's the same way of stasis and the pathophysiology of the clot. Stasis, stagnation, right? If you make the blood thinning, or if you make the blood thinned, okay, or you're thinning the blood, and there is stagnation, it will be difficulty to have a clot. But if the blood is thick, dehydration, for example, the dehydration one of the cause of the stroke, right? Or the precipitating factor. Let's don't say the cause, but one of the precipitating factor if the patient is dehydrated. You got it?
It's okay.
Yeah. Once the blood is thick or sticky, or I can say too much difficult to move, so it will be a clot simply. But once the blood is thin, it will run without sticking to each other, and no clot will happen. This is the idea of blood thinning. And by the way, it's in the all movies. Whenever you hear like Grey Anatomy, they are talking as blood thinner. Okay, so be simple as much as you can. Not to say anticoagulant, for example. You cannot say anticoagulant, and you cannot say antiplatelet. Clear now, Dr. Henry?
Yeah, noted. Yeah, okay.
Okay. Any question else? Any other questions? Okay, so the time to thank Dr. Minam, Dr. Fahad. Hopefully the next times will be much better. Dr. Fahad, don't worry. And I'm so sorry again about the comment, but that's why we are practicing to know the mistakes and to try to correct and to practice more, to have more confidence and to gain more of information. Thank you again, Dr. Fahad, Dr. Minam, everyone in this discussion and wrote in the comments. See you tomorrow, inshallah, with the short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.